This
talking to people.
conference will now be recorded.
Nope, I miss talking to people in person. So that's my forte, is talking in front of larger groups. And a little bit about me, I always want you to know who I am. I've been in the business of EMS for about 22 years now, a pretty long time. I was on an ambulance for a number of years, mostly in the north end of Winnipeg. And I promoted it into our 911 center, where I was a supervisor for about 3 years. And I've been in this current role now for about 6 years. I'm the paramedic public education coordinator, and my forte is street drugs. I'm a subject matter expert on street drugs and current drug trends in our country. And pre-COVID, I spent most of my time traveling the country and representing my department, speaking about street drugs. But I'm not going to bother you guys with that today, because you're not my target audience. So we'll talk about some fall prevention. We'll elaborate a little bit more on who we are. There's a little bit of confusion about what we do out there, and we're a fairly robust service. So I'm going to start by talking a little bit about who we are as a department. Trying to get my slides there. There we go. So for those of you that don't know, when you call 911 in the city of Winnipeg, you'll speak to Winnipeg Police to start. And so they're called what's called a primary point of contact. So Winnipeg Police will answer your 911 call, and they'll either send you to their own department, the police department, or if you need paramedics, you get sent over to our 911 center. And we have on staff about 16 911 dispatchers, 24 hours a day, 7 days a week. We're big. People don't realize we have 16 911 dispatchers. Within the city of Winnipeg, we have that many because we answer about 250,000 phone calls every single year. And from that, our department responds to about 110,000 calls each and every year. We're extraordinarily busy. Our paramedics on the ambulances in Winnipeg are one of the busiest paramedic departments per capita in our continent, actually. And we've been making the news somewhat lately with just how many calls for service we do, and we're over the limit of where we should be. So part of the messaging today is going to be when should you call an ambulance, and perhaps when you should not, and we'll discuss some other options that are out there for you. So keep in mind, when you call 911, you request an ambulance. That dispatcher will ultimately triage your call, and they determine who responds to your incident and really essentially how fast they are going to get there. So it's not up to the public to say, send an ambulance, but tell them not to turn their lights and sirens on. We get that a lot. That's not how things work. Things get triaged, and we dictate and determine who we send to that call. I always start by saying, I get asked all the time, why do you send the fire department to your calls? They respond to about, I'm going to guess and say 30, maybe 40% of our calls for service. And the reason why they respond is they have what's called a primary care paramedic on every fire vehicle. They can provide a set of basic life support skills while they wait for the advanced care ambulance paramedics to arrive. So at least they can start. They can start some patient care because the ambulances are just that busy. They're not always right in that neighborhood where that call is. So to be transparent, if you need an ambulance in St. Mattel, unless we have a South End ambulance, that ambulance could respond from St. James or North Kildonan or Transcona. We do that many calls in the city of Winnipeg, our ambulances. I just can't stress enough. They're screaming busy. And again, the advanced care paramedics are on the ambulances. That group of paramedics, the advanced care component program is about a 4-year program. So they're in school for a long, long time. There's not much that a hospital does that we don't do. We also have supervisors. And this is just to expand on who we are. So our medical supervisors are out in the field. We have 4 of those people per shift. And really what they do is they roam around the city of Winnipeg. They're pediatric specialists. So essentially, when there's an emergency for a munchkin, a newborn baby, or generally somebody under the age of about 10 years old, that paramedic supervisor will respond to that incident, and they really manage that call. Kids are not fun to work on. They're high stress calls. We all love kids, and so we want a highly trained paramedic to deal with those children. We have community paramedics. A lot of people don't realize how many units we have. Community paramedics wear a different uniform, and they never transport to the hospital. That's the biggest thing with them. They can assess you, diagnose you, medicate you, they can treat you, they can suture wounds, they can set you up with specialists in the hospital and leave you at home. That's the future of what we do in our country. Community paramedicine is really the future of what we do. We need to stop transporting everybody to the hospital. Taking everybody to ultimately a hospital is not always the best answer. So we want to treat people more at home and really keep you where you're comfortable. We have tactical paramedics. So these are tactically trained paramedics. They're embedded with the Winnipeg Police tactical team. So they wear their big armor and helmets, and they break in doors of criminals and do high-risk warrant takedowns and gun calls. And that's a pretty interesting unit. I got my tactical training in Dallas, Texas a number of years ago. I was one of the first two in Winnipeg that got that tactical training. And we really started that program about 10 years ago because when Winnipeg Police were in a hostile situation or a gun call, the ambulance would typically be parked 4 or 6 blocks down the street because we don't want to be in that danger zone. That doesn't work too well. There was an incident on Jubilee a number of years ago where a local criminal, I'm going to mind my words, actually ended up shooting a couple of police officers, and the ambulance was 4 blocks down the street. So we knew we had to do things differently. So that's when you'll see again paramedics wearing all black uniforms. That's what they do. And at the end of the day, we're part of the healthcare system. So we take you to the hospital if you need transport. Okay, so that's kind of who we are. That's a quick snapshot of what we look like. I know we have a small group today, but I'm sure you'll share the information with everybody. If you are deaf, hard of hearing, or nonverbal, you can sign up with your cell phone provider to text to 911. You may not be super cell phone savvy. I'm not, but again, those folks need to access 911 just like the rest of us can. So I'm going to look at your pictures by show of hands. Is anybody nonverbal or unable to hear me talk right now? And so I see most of you know. So just spread that word. And essentially what that means is folks that, again, can't communicate verbally, or they're deaf, or they're too hard of hearing to communicate on a phone, you can dial 911 and you literally text message with that 911 person. So that's a good thing for folks that are affected by that. And as we move into the future, if you're in a situation where you can't speak because you're in danger or whatever's happening, you can have that live text message chat with us, okay? So I'm not going to get into this one too much. I didn't see any hands go up, but again, you sign up with your cell phone provider and they will install the technology that you need on your device, okay? So when we talk about ways to keep people safe, I think you can already see the answer, but falls in our society are not talked about enough. We respond in Winnipeg every year to about 10,000 fall calls. Just in Winnipeg, 10,000 falls. And most of these are not happening outside where people think that they're happening. Most of our falls are happening in the safety of your home. So either in your condo, your house, your apartment, wherever you live. That's where we're responding to most of these falls. And the senior population, not to pick on seniors, but if a senior has a fall, their rapid decline often starts very, very soon after that fall. That's a very known thing. And I always give a shout out to my own grandma. Bless your heart, grandma, I love you. My grandmother had a fall when she was very, very healthy and able and young. And when I say young, I want to say she was 78 or 82 years old. And you have to appreciate that when I say young, seniors and old age has evolved and has really changed in the last 10 to 20 years, where to us as healthcare providers, somebody's not elderly until they're well into their mid to late 80s. So anyway, she was healthy, able, very active. She had a fall and fractured her hip. And right after that, she was paneled for a nursing home. Typically, folks don't thrive in nursing homes. That's just a fact of our life. And she had passed away within about 6 or 9 months. And that story is extremely common. And I'm sure you all know folks that are elderly that have had a fall that have just gone downhill very, very quickly. So we want to keep you upright. We'll talk about why this is happening. But in Canada, falls cost over $8.7 billion a year, over 4,000 deaths a year, and over half of the admissions to hospitals in our country are caused by falls. That's incredible. 30% of the ER visits, or over 1 million ER visits a year. That's a huge problem. And, you know, the other ones are important. We talk about heart attack and stroke and traumatic injuries and cancer and diabetes and renal disease. And those are super important, but I can tell you they pale in comparison to the effect on healthcare as opposed to falls. But why don't we talk about falls very much? I'm going to suggest because it's not very sexy. Right? The big ones that we talk about garner more media attention. They're more interesting. So we kind of, we're not talking about it enough. That's a cute picture of a polar bear. Again, people think our falls are happening outside, where we get some, but most of them happen in the safety of your home. I like polar bears. I grew up in Churchill, Manitoba as a young child. So my heart's in the north, and I love bears. I thought that was a super cute picture. So the group that I'm talking to now, I ask everybody that I talk to, do you have a regular routine of moving about, of exercising? I always say you don't have to go to the gym with me and bench press 300 pounds, but you want to be as active as you can be, because it does a couple of things. It increases your core strength, which provides you with more balance. It keeps your blood flowing through your body. If you live a sedentary lifestyle, your blood pressure tends to creep up, and you can develop blood clots in your feet or your legs. And if those blood clots break off, that can cause a stroke. So you want to keep your body active. If you live a sedentary lifestyle and you have a fall, as opposed to somebody that exercises as much as you can, you're going to absorb the impact of that fall a lot better than somebody that doesn't do anything. So again, it could be something as simple as going for a walk. In the wintertime, walking through a mall, and I know things have changed now with COVID, but if you're wheelchair bound, even a lot of people in wheelchairs will still move about. You can get your arms moving, get your legs moving. It's about ensuring that that blood is still moving through your body, okay? Medical checkups. So that's a picture of community paramedics. You can, again, see they have a different uniform. Not very flashy. They work with vulnerable patients in our community. And I stress this one, you'd be amazed how many patients we encounter that haven't seen their family doctor for 5, 10, 15 years. And their attitude is often, there's nothing wrong with me, so why would I go in to be seen? And that's pretty scary. You want to at least go in once a year for that physical to say hi to your doctor. That way your physician can find disease processes before they're a huge issue. And you have to remember, a lot of disease processes or illnesses don't present with outward symptoms until they're too late. You're not going to know if your blood pressure is creeping up or your blood sugar is maybe rising. You're having some early onset of renal issues or you know, a respiratory issue. People wait until they have a screening issue to go in and be seen. Don't do that. You want to catch these things early so you can treat them. An example, I often give stories in my presentations, but a young middle-aged guy that I had dealt with a number of years ago, it's pretty sad. He was dying at home, and he had looked at me and he said, I literally had these symptoms for 5 years and I did nothing about it because I was too busy with the kids, too busy with work. I didn't do anything for 5 years, and he was dying, and he ended up getting cancer that would have been treatable. So that's a pretty on the far end of the spectrum, but don't wait until you have big issues. Please get yourself checked out. Take your medications as you're supposed to. This seems like pretty common sense business, but Our paramedics in the field are still encountering patients that are prescribed a medication, and when they think they start feeling better, they instantly stop taking it. They think they don't have to take it anymore. Don't do that. You have to have that discussion with your pharmacist and your family physician in order to stop medications that you're taking. And something as simple as herbal remedies or vitamins, you have to tell your, mainly, especially your pharmacist, but your family doctor, what you're currently taking naturally. Naturopathic physicians or even multivitamins can have effect and not jive well with the current drugs that you're taking. And a prime example of this is an antihypertensive medication for high blood pressure. If you take grapefruit juice or eat grapefruits, it cancels the effect of that medication. So again, you discuss that, hey, I'm taking this herbal remedy or this vitamin, tell your doctor and your pharmacist what you're taking so you're not mixing things that shouldn't be mixed, okay? I can tell you in the field, one of the biggest things that we don't like as paramedics are area rugs and improper bath mats. Most of our falls are happening in, I would suggest, in bathrooms or living rooms. And again, area rugs and improper bath mats are the two biggest causes. And I'm going to talk more about those in a bit. By show of hands on the screen, I can see you all. Does anybody have a flashlight by your bed? Excellent. So that's not too bad. I see 2 out of 5. Usually some of the groups I talk to, depending on what I'm doing, I've spoken to as many as 1,000 people at a conference or 150 people at a gathering. And there's a handful of people that put their hand up for this question. The reason why you want a flashlight by your bed is so you can navigate at night if you lose power. If you live in a block where you have a backup generator and your power fails, you still need a light source, because 2 times in my career being downtown, in big, tall senior blocks, they've lost their power and their backup generator failed to get turned on. It did not function. And I can tell you one night when this happened, there was a pile of seniors that were falling down the stairs trying to get from the 15th, 20th floor down to the lobby, and they couldn't see a thing. Again, pretty far on the spectrum as an example, but you want that flashlight. At a minimum, get motion sensing night lights. There's a picture of one there that either senses when it's dark and it naturally turns on, or you get night lights that sense motion, they turn on for 1 or 2 minutes and then they turn off. And I have these in my house. I'm a relatively unhealthy guy, and my house is always coming to life at night. I've got a couple of cats, so they're always turning on these night lights at night. And good idea to have a clear lit path from your bed to your bathroom, from your bed to your kitchen. So I would suggest 90% of our falls are happening at night when people are going from their bed to their bathroom or bed to your kitchen. And either you can't see, you're not putting your glasses on, you're leaving tripping hazards in the way in the form of books or magazines or slippers or clothes. Make sure your path is clear, especially at nighttime, okay? Vision checks, again, seems pretty straightforward, but if you've been wearing the same glasses for 5, 10, or 20 years, it's probably time to go and get yourself looked at. Glasses are not designed to be worn forever. And you'd be surprised how many people we encounter. Again, 10,000 falls a year. A lot of people are saying that we respond to is, I've had the same pair of glasses for 15 years. That might be the cause of you tripping and falling. Okay, so more about these improper bath mats that I'm talking about. We see a lot of completely unnecessary critical fall injuries in bathrooms. Because what's in your bathroom? You've got a hard toilet, a hard countertop, a hard floor, and hard plumbing fixtures sticking out of your wall. So we see a lot of either head lacerations or head injuries from these falls. A lot of them happen when you're getting out of your tub or out of your shower and you're stepping on your floor. If you use a chunk of carpet, a towel, or an improper bath mat, your feet are going to go from underneath you and you're going to have a fall. The proper bath mat has a thick cotton top where it can actually soak that water up. And the biggest thing is it has a rubber bottom on it. So that area or the area rug or bath mat is not going to slip on you. You'd be amazed how many people use carpet or towels as their bath mat. And they're gonna fall down. The assist bars you can see in the picture, like the assist grab bars, all of you may not need these, but don't wait until you have the incident to affect change. And that means you don't wait till you have an injury or a fall to say, I better change the way that my bathroom is set up. Be proactive and get these things put in if you think you need them, okay? Go back to that one really quickly. Clean up your water spills as well, right? Kitchens and bathrooms are two areas where we often have little spills of water and they're on a hard, slippery floor. So make sure you clean up those water spills quickly. This is pretty straightforward stuff, healthy food choices. I won't go into this too much, but a lot of the research is finding that our seniors are relying on processed frozen meals for lots of their meals. If you rely on the microwave oven for most of your meals, be careful with that, because frozen meals are highly processed. They're packed with sodium. That's why they have a shelf life of 500 years. They're loaded with salt. That's going to cause your blood pressure to elevate. If you're sustaining a high blood pressure consistently, that's going to make you feel dizzy and lightheaded. A lot of people don't realize that. Low blood pressure can cause that, and hypertension can also make you feel dizzy and not quite as steady as you should be. And what happens there when you're dizzy and lightheaded, you have a more probability of falling, okay? Make sure you incorporate some fresh food. Staying hydrated. This simply means we have to intake water. Again, it feels like I'm picking on seniors, and I'm sorry, I'm not, but they're finding up to 90% of seniors are chronically dehydrated. And that means you're living a life where your body is chronically dehydrated. That's not good. It puts a lot of strain on all of your body systems. The electrolytes that you rely upon to function, like your calcium, potassium, and your sodium, are going to be super wonky. And what does that do? It puts lots of stress on your body. It makes you lightheaded and dizzy and more prone to falls. Coffee and tea and alcohol will further dehydrate you. So don't rely just on coffee and tea. You have to intake water. You'd be amazed how much better you'll feel if you include water in your diet every day, okay? Footwear, you can't see me in person, so I didn't have a chance to fashion my my big purple stilettos for you, but those would be improper footwear, right? Anything that doesn't have a slip-resistant bottom. It could be something like Crocs or slippers. You'd be amazed how many people are wearing those, and that's their sole source of footwear. Crocs and slippers and sandals are not proper fitting slip-resistant footwear. Again, you may not be affected by this, but if you're prone to falls, you've had a fall, or you have a concerning medical history, get proper slip-resistant, proper fitting shoes. If you use a walker, please know how to use that device. A lot of walker patients are not comfortable using them. They don't know how to use the braking system, and they're limited. We see a lot of fractured hips from people that use their walker as a chair or means of pushing themselves up, but they don't know how to use the braking system. So what happens? The walker shoots down the street. The poor person has a fall, and that could result in a fractured hip or a fractured wrist, whatever. Know how to use those devices. If you use a cane, you should have a rubber stopper on it in the summertime. And in the winter for your cane, you can get those little flip over, almost like an ice pick. And those are designed to really to dig into the ice that we know is all coming. If you go for a walk in the wintertime, good for you. That's fantastic. Consider going in a group, or at least telling somebody that you're going out for a walk, and maybe check on me to be sure that I made it home. Every single year we have a handful of people, and unfortunately a lot of seniors, they venture out by themselves. If you have a fall and you fall behind a snowbank that's taller than I am tall, vehicles will drive by you all day long. I've seen it a number of times. So go in a group, tell somebody you're going out at least, or bring your cell phone if you have it. So if you do have a fall, at least you can call us for help, okay? You can get slip over. They're almost like shoe spikes. I think I've got one here. I do. I'll hold this up so you guys can see that. You see that? So it's like a slip over shoe cover, I guess you can call it. And they've got really sharp spikes on the bottom. And these are fantastic, especially if you're active during our cold winters that we know will be coming. Please be careful out there. Okay. Show of hands, does anybody have stairs in their current house or condo or apartment? Yeah. Okay. So what I want to tell you about stairs is that can be a form of exercise. That's fantastic. If you live in a home or a condo block and you're physically able to, stairs are great exercise. If you're physically able to, consider using the stairs instead of the elevator. It's a great way to keep your blood moving. But again, please be careful. Don't accept tripping hazards and say, I'm going to get to these later. Please don't do that. The picture you can see there is a picture that I took in somebody's home. And that was a 2-story house that we did a call to a while back. And you can see how the carpet is puckered up. That's a pretty blatant hazard. The other end of that carpeted hallway was the stairs going down to the main floor. This is a pretty sad call. This is a family that lived with grandma. Grandma was healthy. I don't remember how old she was, but they accepted that they had that tripping hazard, and they just said, don't worry about it. We'll fix it eventually. Just keep stepping over it to get down the stairs. Well, the family left for the weekend, and they left the grandmother at home alone, which they did often. She was very capable. And when they came home on a Monday morning, she was found at the bottom of the stairs. She had finally tripped on that tripping hazard, and she went down the stairs, and she was found about 2.5 days after the fact. So do not accept tripping hazards. Please get them fixed before you have the incident. Okay. That's a pretty common one. We've all seen these, sort of like an entrance mat or an entrance carpet to a shopping mall or a doctor's office, wherever. They're all over the place. This was in a school in Winnipeg, and not a super traumatic injury, but this was a young boy that had tripped on that, and he extended out his wrist, and he had a bone fracture in his wrist from trying to stop his fall. These are everywhere. No, these are a tripping hazard. They are. And they're often rolled up or the edges are puckered up. You can see that one had some rolled up edges where you're going to catch your toes or your wheelchair or your walker and you're going to have a fall. So I tell everybody in our community, look out for other people. If you see these entrance rugs are rolled up or curled up, just give it a kick with your foot to knock it down. So the next person maybe doesn't have a fall on that. This one really stands out for me. This was another home that we responded to. And you can see they've got a hardwood kitchen on the top with about a 1.5-inch molding, which is a blatant tripping hazard as it is to their carpet living room. And that wasn't bad enough. They ran their electrical cords all over the house. They had extension cords everywhere. And the patient that fell in this home lived alone, very active, somewhat healthy. They fractured their hip. And after that, they were paneled for I think a nursing home within about 9 months or 1 year. So they just deteriorated very, very quickly. But again, they accepted that as a tripping hazard and they added more tripping hazards by running extension cords all over the place. So don't have that. Don't run cords all over the place. If you need to run cords, have them tucked right up against your wall. Consider putting them either in behind furniture or even tape it down so you're not running cords everywhere. Okay. I always say there's no way that's a city Winnipeg sidewalk, right? We know these are everywhere. And again, I applaud people for being active and getting out, but just be aware that, yes, we have some issues with our sidewalks and roads. Just be aware where you're walking, okay? Don't use your stairs as a storage shelf. Stairs are not designed to store books and laundry and whatever, groceries and cats and whatever else you have stored on your stairs. Keep them free of clutter, okay? I hate showing you this, but we know this is coming. We've been lucky so far. Keep your snow and your sidewalks, pardon me, and stairs clear of snow and ice. It makes a safer environment for you. And it also, if there is a call for an ambulance, it allows us to get in quicker. You would be amazed how many houses we respond to, no matter what part of the city you're from, and we're having to navigate over 4 or 5 foot snowbanks, and we approach the house and we're knee-high deep in snow. A lot of people don't shovel their walkways. Please keep those free of snow and ice. Before we change it up a bit, that's a picture of hoarding. If you've never heard of that before, there's usually a mental health component that is connected to this. So it's usually not just a matter of somebody being lazy, usually not. So please get the help you need if that's how you live. That's a picture of a house that I've been into. I've seen many, many homes like this when I supervise in our 911 center. I want to say we have about 48 or 50 plus homes that are flagged in our system that look like this. So we can tell the paramedics what to expect when they get there. I don't work for the fire department, but the fire department people should also know that's what they're going to be facing. Okay, so get the help you need if you do happen to live like that. Okay, so we'll talk about ERIC kits now. Show of hands, is anybody familiar with the ERIC program? All right, so that's not bad. 1 out of 4. Yeah, it's okay. So I'll educate you on what the ERIC program is. I will supply you with ERIC kits. I'm chronically running short, but I've got a shipment coming in. So emergency response information kit is essentially what these packages are called. And we've been using these as an emergency service for, I'm going to say, going on about 20 years. It's a packet of information that's designed for the paramedics or healthcare providers to access. They can find out who you are, your medications, who you are, your medical history, your next of kin. Lots of real good stuff is in that kit. It's designed to be hung on your fridge. That's why there's a picture of a fridge there. So the paramedics come to your house and they head to your fridge. They're not hungry. They're looking for your ERIC kit. And there's a red sticker that goes on your door to tell the crew that you have one of these kits. There's lots of help out there to help you fill it out if you need so. Obviously, family, relatives, healthcare providers, senior council members will certainly help you fill it out. The kit has a brochure, a health and medication form, a healthcare directive, and a door sticker. And I'll walk you through what all these things are. If you speak French, you flip it over and it's in French. Okay. Everybody has a purple health card. A little secret, if you go to the hospital, you don't have to bring this with you. I know the hospital wants to say bring it with you. That's their own prerogative of it. These have a high likelihood of getting lost. It's incredible how many people lose these health cards. Copy that information down on your ERIC kit. If you go to the hospital with us, the paramedics will document that on their laptop computer, and they can relay that information to the hospital simply when we get there. Okay. If you don't have a health card or we don't know who you are, that happens all the time. You're literally called John Doe or Jane Doe with a number after that. But having these cards or the numbers at our fingertips makes it easier for us to know who you are, obviously. Organ donation. This is one thing that people don't like to talk about because it's awkward. I understand that. It means that you passed away. That's part of life. But please be part of this program. They want you to sign up on Life now or sign up online. We used to have a donor card in these kits. They've kind of gone away from those. They want to streamline things and have you sign up online, sign up for life.ca. You do not have to be a young, healthy athlete to donate your organs. You don't. The oldest organ donor that I'm aware of was over 90 years old, 90 years old. You don't have to be a young, healthy athlete. There's a variety of things that you can donate. I've seen the benefit of this. I can't tell you how many times. One incident in particular was a very young fellow that had died at home. It was very sad, but he was able to donate his organs. And we were able to sort of track what happened to those body parts. He was able to donate parts of his eyes so a 6-year-old boy could see. That's amazing. So please consider being part of that program and at least have that discussion with your family, okay? Medications, there's a medication card within the ERIC kit. We want to know the name, how much, how often, the reason why you're taking it. I'll tell you a little secret. The ambulance paramedics are likely going to know all the medications that you're on and why you're taking them. But I want you to know why you're taking the medications you're on. You'd be surprised how many people in our community are given a suitcase of pills from the doctor and they have no idea why they're taking them. You're in charge of your own health care. You have to know why you're taking the current medications that you're on. Remember, as paramedics, we can provide a medication to virtually fix anything. And sometimes when we dose or we calculate how much to give you of a particular drug, that can be based on the current medications that you're taking. So it's really helpful to us if I know what your current drugs are. And keep these updated. This is a big issue with these kits is people, when they first get them, they do a great job filling them all out beautifully, and they forget to update them. I responded to a call in St. James some time ago. I haven't been on the street for a long time, but it was a patient in the middle of the night that was very, very critically ill, but we could fix that problem very easily. Her lungs were essentially filling full of fluid. So I looked at her Eric kit and I said, I can see you're taking, I think it was 40 milligrams of a drug called Lasix. And she says, oh no, dear, I haven't taken that in 10 years. But her Eric kit still showed she was taking this. And that would have altered the dose that I was going to give her, okay? You don't have to write these all out. A little secret again, you can go to your pharmacist. He or she can give you a printout of all the medications you're on for free, and you can just attach that to the kit, okay? Makes it a lot easier. We want to know what your medical history is, obviously, illnesses, surgeries, allergies. This focuses the assessment that we're going to do on you. And at the end of the day, we take you to the right hospital. And usually people say, what do you mean the right hospital? There's certain facilities in Winnipeg that manage certain conditions. So be it a traumatic injury, a vascular issue like an aneurysm, a stroke, a heart attack. There's certain hospitals in Winnipeg that specialize with certain issues, and that's where we want to take you the first time. We don't want to have to transfer you after the fact. Okay? A healthcare directive. I'm going to talk about this one for a good couple of minutes. Is anybody familiar with a healthcare directive or a living will? Okay, good, good. So the amount of people that I talk to every year, you'd be surprised how many people have no plan. People in my own family, it's going to sound strong, but if you don't have a plan, in case something happens to you, a medical emergency, you're dead, you're dying, to be blunt, or you can't make decisions for yourself, shame on you if you don't have a plan, because you're leaving that responsibility to your family. That's awful. I can't tell you how much death I've seen in 22 years. I have no idea anymore. But it's palpable when you see somebody that has a plan. It removes a little bit of hurt and heartache from your family because you're making those decisions for them. Why would you want to leave that for your family? It's just another big stressor that you're leaving for them. So a healthcare directive or a living will is a legal document that you tell the healthcare providers what you want and what you don't want. And that's a legal document that we have to follow. So some people may not want CPR. Maybe you don't want us to put a breathing tube into your trachea. You don't want a certain medication. You can tell us what you don't want. Attach that to your ERIC kit and we'll follow what those orders are. The only caveat is we have to have the physical copy. It has to be signed and we have to see it. You'd be surprised how many cardiac arrests we respond to and the family says, stop what you're doing. They wouldn't want this. That's not how it works. We're legally obligated to perform unless we see that document. Okay, so fill that out, have that discussion with your family. I've had the uncomfortable discussion with my parents, who I adore. I'm a very, very lucky boy. I've got phenomenal parents, and I can't fathom the day of having to act on that, but at least I know that there's a plan in place, okay? Power of attorney, remember, I'm not a lawyer, but a power of attorney for the most part does not make healthcare decisions. They make financial decisions, mainly. A lot of people think I've got cousin Johnny, who's my power of attorney. He can speak on my behalf. That's not necessarily true. That's what a health directive is for. A proxy will make healthcare decisions for you. A power of attorney generally cannot do that. Okay, so again, the air kit on your fridge and the red sticker that you can see goes on your entrance door tells us you have a kit. Okay, we want to know your family doctor next of kin. We don't really care who your family doctor is anymore. That used to dictate where we transport you to. Things don't really work like that anymore. And next of kin is pretty obvious. We want to be able to reach out to your family if there's an issue with you. Could be an emergency or something as simple as you fracturing an ankle or a wrist. We still want to be able to reach out to your family. Okay. So there's only maybe, I don't know, 5 or 6 more slides, and then we'll have hopefully a few questions. But when we talk about calling 911, you have to remember emergency medical services in the emergency room are designed to treat emergencies. They're not designed to treat people with a sore toe or a mosquito bite or a sore ear or non-acute chronic medical conditions. We don't have an unlimited number of ambulances within the city of Winnipeg. That's pretty obvious. But every time you remove an ambulance, you remove its ability to respond to that critical emergency. And I'll be transparent to you guys. It's really frustrating when I was on the street and I'm tied up on a call because somebody's had, I don't know, maybe a cold for 6 months or a sore ear or they stubbed their toe or they got bit by a mosquito, which yes, we sometimes do those calls. I'm now committed to that patient. And if I hear a call in the neighborhood for a child hit by a car or a stroke or a heart attack or a seizure, I'm stuck on that incident. So before you make the 911 call, just ask yourself very quickly, is this an emergency? If it's not, we're going to work our way down the list to see what other, maybe some other options for you are. So some examples of life-threatening emergencies were absolutely call 911 anytime you're having chest pain. Anytime you're having chest pain, call us. Our ambulance paramedics have the ability to treat an active heart attack in the community just like a cardiologist does at the hospital. And in fact, what we'll do is we can diagnose that heart attack and we can give you that clot busting medication in your living room. We'll dial up on our cell phone. There's a cardiologist at St. Boniface that's always on call that we have access to 24/7. We'll call that physician, we'll discuss your case, and we don't take you to the emergency room. We take you right up to surgery. It's amazing. So call us if you have chest pain, uncontrolled bleeding, sudden or severe pain, coughing or vomiting blood, anytime you're short of breath that's abnormal for you. And what I mean by that is shortness of breath is not a good thing, obviously, but if you're chronically short of breath, you're going to be the best gauge on if you need further help, okay? Sudden dizziness, weakness, change in vision, or change in your mental status. That could be a sign of low blood sugar. That's something we can fix very, very easily. Could be an infection or a stroke or a bleed. Call 911. Severe persistent vomiting, diarrhea. This one's a little confusing because you're thinking vomiting and diarrhea, why would I call 911? And the key word is there, severe and persistent. Again, if you're acutely dehydrated, that's a medical emergency. Call us. And sometimes if you're just, if it's a matter of maybe giving you some fluid and some medication, we can do that at home and maybe we don't have to take you into the hospital. Anytime you're having a baby, I'm going to probably suggest that most of the group I'm talking to today will not be having babies. But I always say people shouldn't be delivering babies out of hospital without help, right? If you go a different route, a midwife, or that's fine, that's help. But we deliver a number of babies, each and every year. So call us if that's happening. I'm not a big baby guy. I think I've only delivered, I don't know, maybe 2 or 3 kids in my career. I haven't got a lot of those calls, and those are super fun usually. I mean, babies have been delivered for thousands of years. It usually goes quite well, fairly easy, but when it doesn't go well, it's really scary. So don't be scared to call us. If you do decide to act, please don't move the person. If they're in imminent danger, sure, gather the troops and get them out of that dangerous scene that they're in. But we don't want to cause further injury. And I don't want you to cause an injury to yourself either. If your friend or loved one or neighbor falls, be very careful thinking you can just pick them up. If they have a spinal injury or a head injury, we want to keep them, down on the ground and wait for us. Don't give them anything by mouth. And what I mean by that is don't share medication. That still happens quite often. And don't even give them the magical glass of water that I'm kind of making fun of, but it's well intended, but everybody says, oh, get them a glass of water with something that's happening. And all you're doing is potentially creating a choking hazard. I've seen it many times with the unconscious patient, and a well-intended bystander, neighbor, or loved one is pouring this magical glass of water down their throat. They're unconscious. Don't give them anything. Water is not going to help them, okay? If you need to stop bleeding or do CPR, deliver a baby, stop a bleed, our 911 operator will tell you what to do. But don't thrust yourself into an incident that you don't know what's going on. That kind of goes without saying. If you see something going on out in our community and you don't know what's happening, don't thrust yourself into it. Winnipeg can sometimes be a bit of a scary city, so don't thrust yourself into something you don't know what's happening. Save it for us to deal with. Pretty straightforward. When you call 911, speak calmly and clearly. I understand it sounds straightforward, but most of our callers give us the information that we need. Very, very unoften that we have a 911 caller that we can't get anything out of. It happens, it's very, very rare. And I can tell you from my experience in the 911 center, an inconsolable caller is usually dealing with a baby or a child. Something terrible has happened to their own little munchkin, and we have a hard time getting what we need out of them in that case. But we need to know the address and the reason why we're coming. If you call from a landline or a home phone, we already know who you are. Our screen magically populates with who you are and your address. But if you call from a cell phone, it doesn't tell us where you are yet. We don't have the technology to hone in on where that call is coming from. And if somebody calls 911 and you say, send an ambulance, and you hang up the phone, that's not good enough. We have to know why you're coming. We do our best to determine if the scene is safe for our crews to go in. If we can't get the information we need to determine what's happening, we'll respond with the police, because there's many times in our city that people are not going to be honest and forthcoming with us what's actually happened on scene. Okay. So a couple more slides, some less urgent issues that may still need a hospital and maybe a transport by ambulance could be stable fractures and sprains, back pain, wound issues, headaches and migraines, maybe moderate long-term issues that you're dealing with. You still need a hospital and ambulance, but you may have a little bit of a delay in us getting to you. These less acute issues have to be triaged, remember. So the 110,000 calls we do a year, we have to triage what has to go out right now and what some of the incidences are that can wait. I am a guy that way too often I get absolutely debilitating migraines. I've had migraines since I was a young boy, and they just debilitate me. But now that I know what they are, they're not a medical emergency. So if you have sort of, I'd say, again, non-acute issues, still call an ambulance, but you might be looking at a little bit of a wait. And it's not that we don't care. We have to deal with the acute issues first, and then we work our way down the line. Okay. Non-acute issues, really non-acute issues like colds, sore throats, bug bites, sinus infections, non-acute medical conditions. I really suggest you don't call 911 for these. Consider a quick care clinic, a walk-in clinic, make an appointment with your family doctor. HealthLinks is an excellent resource. You can phone, you can see the number is up on the screen. And HealthLinks, you'll actually speak to a real live nurse, and he or she will help you with the issue that you're dealing with that day. They can help diagnose, they can help treat, and they'll tell you what you should do. Either yes, call 911, or don't worry about it. You can self-treat at home or set up a doctor's appointment for yourself. Okay. So again, before you call, just ask yourself: is it a true emergency? If it's not, maybe you can consider some of these other avenues. Okay. That slide I can probably get rid of. I always just say that Again, this doesn't really, pertain to this group, but if you have grandkids out there or kids, whatever, make sure you're engaged and make sure that you're talking to them. If your groups, I'll say to all of you at any time are interested in the substance use programming that I offer, street drug trends, let me know. I'm happy to present that to anybody. You're not my target group, but it's a big issue out there. So keep that conversation going. Questions you can fire away now. That last picture is a picture of what's called a MERV. I like ending with that. I don't know if anybody's seen it, but it's an ambulance on steroids, basically. It's not a transit bus. It's not going to take you shopping. We can transport about 8 stretcher patients on that vehicle. So it's an ambulance that's just super big. It responds to mass incidences where we have lots of patients. Okay, now that my voice is almost given out, I'll wait for some questions now. I see one hand up.
Very informative presentation, Corey. Thank you very much. Question I have is, where can I get one of those ERA kits?
Yeah, so I can supply you folks with them. Whoever is kind of taking the lead here, I can definitely set you up with some of those kits. There's a few senior resource council buildings throughout the city of Winnipeg that can also manage those kits for you.
Okay.
I don't know if they're short of kits, but I'm happy to provide you with a bunch. Hey, yeah, another.
My question is about the health links. Now, we had an incident at home here a few weeks ago, a couple of months now, and my husband tried to call health links. He was on the line for about 45 minutes and still didn't get through. In desperation, he hung up and called 911, which turned out it was the right thing to do. But I'm just wondering if this is typical. I mean, it was a Sunday evening, but still, is it typical of taking that long to get through the health links?
Very good question, and the answer I'm going to give you is that's not super typical. I think what you're seeing is because of COVID, and I don't work for health links obviously, but they are inundated with calls right now, much like we are. So I think as we're navigating this COVID world, I think resources like health links are probably being inundated right now. So I would imagine that's probably what you're dealing with. So good on you for saying, okay, enough waiting, let's just call 911. Absolutely. So don't forget, the message is never don't call us. If you have an issue and you just don't know what to do, you're scared, you don't know where you should be going, call us and we'll absolutely work with you. Okay, so to answer your question, I would say that that's not super usual.
Okay, and I would say as well that I give kudos to the department that came. I mean, they were super good, and the one thing about doing it that way is then you get into ER directly instead of, if my husband had taken me, it could have taken much longer, I think, and it wouldn't have been assessed earlier. So I think that was very important.
Yeah, that is great to hear, and thanks for saying that. And let's just remember, so when you get to the hospital, it's if you're brought in by an ambulance or a stretcher car or a taxi or a relative or a family member, you're actually triaged just the same as a waiting room patient is. So we work with the hospital, and obviously when you have a paramedic that's providing a history and vital signs, any medications we've given, that paints a much better picture. But if somebody's in the waiting room or brought in by a taxi cab that's more acute than you are as an ambulance patient, we'll actually be booted down the line as well. So taking an ambulance does not necessarily mean that you're going to get in quicker. Okay.
The other thing I would say is that I picked up the ERIC package at the local fire hall.
Yeah, and thank you for saying that. That's certainly another resource that we can use. I think we're saturated with COVID, but we're trying to get people to avoid our buildings now.
Okay.
And to be honest, our fire paramedic stations don't have kits right now. Because of everything going on, my supplier was running short and I had a real hard time getting them. So I'm really the only person that has them right now, but thank you for saying that. When this thing hopefully goes away, you can knock on those doors and they should have a pretty good stock. Okay, and I see Janice had her hand up.
Yeah, I actually put a couple of questions into the chat, and there's also a comment from another participant that had to leave early, but she just wanted to say it was a great presentation.
I see.
So my questions are, you showed the photo of the snow on the outside stairs. Definitely true, that is a hazard. But do you recommend railings for stairs? There's probably stuff in the code, but I did have some stability issues a few years ago, and I came to so many places where the only brace you could use to walk down stairs was the concrete wall of the building or something like that, which is hard to grip on.
Yeah. Yeah.
And
yeah. So to answer your question, do I recommend railings? Absolutely. And something that I've been saying for years and years and years is I don't know why we started this stairs only have one rail thing. I'm a big believer, especially in apartment buildings or outside exterior stairs, why we should mandate 2 rails. So yeah, absolutely. Stairs should go hand in hand with a handrail. And if you're somebody that's susceptible to falls or you think you're prone to falls, nothing wrong with getting more rails put in for sure. Yeah.
okay. All right. And then thank you. My second question is on organ donation. Are there restrictions on organ donation based on illnesses you have or anything? Like, and cancer is the one that I've used as an example.
Yeah, very good question. So yes, there is. And not to give the cop-out answer, but I'm sort of going to do that. So sign up for life.ca and your physician and the organ donation team would be able to work with you to what you can donate and perhaps what you can't. So definitely follow up with them. I would definitely not be the person to say that because of the disease A, B, or C, you're not able to do that. So yes, you can be removed for certain reasons, but they may be able to use other organs. Okay.
Okay. Thank you.
You're welcome. Okay, I think that's it. I think we've knocked off all the questions. I hope it was of benefit for everybody. And I thanks for working with me. I know that the whole virtual world that we live in now is certainly something that's new and different. We're all kind of getting through this together. So I hope it was a benefit. Keep me in mind for any other programming. I'm always happy to come back and work with whoever is my point of contact.
Presentation, Corey. I took a bunch of notes down and I'm going to use some of your tips.
Great. Thank you very much.
Thanks, Corey. That was a very good presentation.
Good. Good to hear. I hope everybody stays well.
Yeah, thanks very much.
Okay, you're very welcome. I'll sign off now. You guys have a good rest of the day.
Okay, thank you.
Okay, bye-bye.
Bye.